to do, because we do want this to be a conversation that you can take something away from it. So, with that said, looking at our time, it's 7 o'clock on the dot. I am going to go ahead and move this on over to Ronice, who is joining us as an expert for the evening. And Ronice, I'm going to let you go ahead and explain who you are and what you do before we kind of get into the full crux of the conversation.
Absolutely, absolutely. Thank you, Lita. I appreciate you and my natural me inviting me to be a guest speaker on tonight. This is great. I love just being a part of communities that are just bringing resources to our communities about what we have available, because it's not always given out to everyone about all the resources that are available. But I'm glad to be a part of this community. So thank you for having me as a guest. So my name is Ronice Lowe. I am a registered nurse. I've been in healthcare for over 20 years. Started at ground level. So I started as a certified nursing assistant. Actually started in the summer before my senior year. I worked in a home. This older woman had a home where she took care of disabled and elderly people. And that's where I started my journey on the career. But it's been embedded in my family for years before that. But I worked as a CNA for several years, and I journeyed on to being getting my licensed practical nurse. And now I am working as a registered nurse. I'm actually traveling as I am doing my company, which I started in 2021, which is Bright Sun Home Care, where I take on the role as a medical case manager. So in the hospitals, how I describe that is, in the hospitals, when you're being discharged, your loved one is being discharged, they give you a list or a booklet, I call it, of items to follow up with. And so those items could be doctor's appointments, it could be change in medications, it could be wound care treatments. And sometimes you have families that are well versed in those things because they might have been through it several times and they know what to do. But a lot of the times, and I met it in the hospital a lot, where people don't have, either they don't have family or they just don't understand the medical jargon that's in there. So what I do as a case manager in the home or on the community side of things, I help to go through all of that. I help you with setting up doctor's appointments or going to the right doctors, because if you have a new diagnosis, you want to make sure you follow up with your primary care doctor, but it might entail you needing to have a specialist to add to your team. So I help, put you on the right track of where to go. I also I specialize in wound care. So I've seen all types of wounds. I'm well versed in how to, maybe change things if it's not working, talk to the team, whether that be therapy, because therapy is involved a lot with wound care and things too, as well as your primary care doctor and so on and so forth. So I also, help with, of course, medication management. I just help to assist uh, patients who don't always understand what they're taking, red pill, blue pill. And I try to help them to understand why they're taking it, but also preventative. I'm big on preventative care. So I want to make sure that what you're taking is something that is needed, but maybe we need to go back and talk to the doctor about, you know, is it something else? Is it not working? So just making sure we're working as a team to get our elderly, the best care that they can at home.
I love that. And Ronice, I again am so honored to have you joining the conversation with the wealth of experience and things that you contribute. So I'm excited. And I'm going to introduce our second expert for tonight's conversation, which is Jessica. And I name people my besties and best friends and all that. So, Jessica, I have loved getting to know you and just the work that you're doing as well. So, if you could take a moment again before we kind of get into the topic of this evening, and introduce yourself as well.
Absolutely. Thank you. And right back at you. We're definitely besties. My name is Jessica Fredrickson. I am the Director of Brain Health at Goodwin Living. I have been with Goodwin Living a little over 4 years. My background is in social work. Before my current position, I was a assisted living and memory care administrator and doing some work on a regional team, going around to different senior living communities. But my passion really is around dementia and brain health and how we can empower people to make the most of their brain health. There's a lot of free resources out there, and Stronger Memory at Goodwin Living is one of them, but things that we can do to prolong our brain health. But I also really feel strongly about supporting caregivers. I lead a caregiver support group at one of our Goodwin Living campuses, and I think there's just so much that goes into this, and so much with dementia that is different for every person, but also great tools and communication tips that we can all share. So really excited to be here with you all tonight. Thanks.
Awesome. Well, again, I'm so excited. I'm going to get right into the conversation, and these are pretty informal. I know I've asked my experts to bring slides so that if we need more detailed conversation, but certainly I want this to be just a nice conversation because as a fellow caregiver with you all, I get it, right? And I know how challenging it can be wanting to take care of your loved one, but those difficult behaviors in our Facebook support group, where we have, I think it's somewhere around 3,600 or so, that's one of the common things that come up, the behaviors. How do we deal with the behaviors? So definitely feel free to drop your questions, your comments in the chat. We will make sure to get to those. But Ronice, I'm going to start off with you. So what would you define as a difficult behavior? Kind of start talking about it from that point of view.
Absolutely. So, I like to tell things by stories because I think it just keeps, it helps to grasp and pull things together. So again, I've been doing it for a while, and I've been in the nursing homes. I've been in, people's homes, and so I've seen it from a couple of different aspects. And when they're first starting out, it may be just little things. They're just forgetting things here and there. But as time goes on and things progress, they have those difficult behaviors that it seems like it's just impossible to handle. So I've had patients in the past who, they're in the home, the nursing home, I should say, and they're wanderers, and they may or may not have done that in their lives, but this is a new experience, and the family is wondering, why are they wandering into other people's rooms? They've never done this before, and it is just a shock, and sometimes it can be embarrassing, is the word I use for it, for the family, more so than the patient, because they don't always understand what's going on. And
Yeah.
so they will have maybe there is difficult to say, to revert back to a time where, they used to be able to go to the bathroom and now they can't. So the way they express that is by, wandering into someone's room, and, they're wandering for a reason. So, I've learned over time is that, okay, this behavior it might be new, but why are they doing this behavior? So trying to find out what is the pattern here. And again, a lot of times when they're wandering is because they need to use a bathroom and they're trying to find the bathroom and they're wandering to someone else's room. So that's one behavior. Another behavior is just being, frustrated about things, and, they want to be a little aggressive at the dinner table or so on and so forth, and they don't want to eat or something. Maybe it's because it's not the right food that they like. I know a lot of times our patients have family members that bring them in certain things that they like. Like over the weekend, I had a patient who was in the hospital with us, and his wife stays with him a lot of the times. And she says, he just doesn't like this type of food. And it's not anything to the food, or to who made it, but it's just to their preference. And us as caregivers, we may not always know that, but the family being there makes it easier because they can tell us, they really enjoy oatmeal, or he really enjoyed cream of wheat. So she would bring him cream of wheat every morning. And it seemed he was like, oh, okay, he calmed down his behaviors because he literally just didn't like the food. So
Yeah.
that's one way of recognizing a behavior such as just being aggressive at a meal or them wandering around. It's something behind that. So just finding that reason out about why.
Yeah, yeah. And again, I'll just emphasize, if you have a specific behavior or challenge you're dealing with, feel free to put that in the chat so our experts can kind of talk about that. I'm going to pivot over to Jessica, because Jessica, I know you really dig into the brain itself, which I've always been fascinated about the brain. So I'm like super excited that we have someone that is an expert on the brain itself. With these difficult situations, and I know that Ronice talked about a couple of them, right? Jessica, can you talk about, often caregivers think that they can control it, or that they're
Right.
right, that they're kind of intentionally being this way. And even when we say we know they
Yeah.
can't help it, we think they can. So can you kind of talk
Yes.
about that piece of it, the difficult behaviors and the level of control they may have over that?
Absolutely. That's a great question. I think one of the big um, kind of mantras that I share when talking about this topic is that all behavior is communication. So they are trying to communicate something with us as the caregiver, um, in a way that we don't usually understand. When we look at behavior through kind of the neurotypical lens, through that lens of I'm a person without dementia, and like if I was acting this way, or if I was shouting at my loved one or ignoring what they're asking me to do, I'd be doing that to excuse my language, to piss them off, or
Mm-hmm.
make them mad. That's the way that we default to thinking, because we're existing in the world and we don't have dementia. Someone with dementia is existing in a very different space. They are trying to communicate something to us with their behavior, but they aren't able to communicate that in a neurotypical way. Their brain physically cannot make the connections that we're making. And so that being said, it's still really hard if you're the caregiver to deal with that. But a lot of the times we inadvertently can escalate, not meaning to, but by approaching it from our natural instinct of thinking that the person can rationalize the way that we can logic the way that we can, um, or that their intentions match what our intentions would be in that situation, we actually end up trying to argue or trying to push and correct. Sometimes I've heard spouses say it almost, or kids, even adult children, it's almost like I'm the parent now. And when we approach it from that angle, we often create more tension and kind of escalate the situation. So I like one analogy that the one of the dementia friendly videos. If you've heard of that group, they do a lot of training on what is dementia, and there's this bookshelf analogy that if you think of your brain as two bookshelves, one is kind of flimsy, and one is really sturdy shelves, big thick shelves, not move anywhere, right? The sturdy bookshelf has all of our emotions and feelings and those types of things in it. And the not so sturdy bookshelf has our memories and our ability to understand processes and how to do things like communicate, or how to what the different steps are to get dressed in the morning. And dementia comes along and it rocks those bookshelves. And another way you can think of it is as one bookshelf where the emotional memories are on the bottom, very sturdy, and that procedural memory, logical memory is at the top. Either way, dementia comes, rocks the bookcase. The books that are less secure, those ones of memory, logic, procedures, those fall out of the bookshelf, or they topple over, and The ones that stay are really that emotional component and the feelings. And that can be a beautiful thing because, we've all seen those moments of connection with dementia and with our loved ones. And that can be a really challenging thing if someone with dementia is scared, if they are frustrated, their reality, what they think is happening in their brain doesn't match the situation that we think, um, or that we know, uh, just as firmly as we know, um, Dad, you can't get in the car and drive. You haven't been able to safely drive in years. Dad knows, oh my gosh, what are you talking about? I just drove to work yesterday. And for him, that's a real thing. For us, that's a real thing. And so we have to look at it as, okay, our brains are both saying very different things. So we have to be a dementia detective. Unfortunately, as the caregivers, we're the ones with full cognitive faculties, and we're the ones who are more adaptable. So we have to be a dementia detective and adapt to try and figure out what's the underlying meaning behind their action or their behavior. A really common one, I'll just share one example, then I'll stop talking for a second. But one example is, I see this a lot more in the professional setting. You have someone who is trying to get undressed in a public space after a mealtime. What our first reaction when we see someone trying to get undressed in a public space is, oh my gosh, that's inappropriate. What's going on? Is that something sexual? Like, wow, this is a really crazy out there behavior. When we dig into why this person might be taking off their shirt or unbuttoning their pants, maybe it's usually physiological and not really that out there or sexual at all. It's usually, okay, they just ate lunch or they ate lunch an hour ago and now they need to use the restroom. They don't know where the restroom is. Let's help direct them. Or oh, now they're digesting their food and their body temperature is rising. So they're hot. They can't communicate, oh, I'm hot. I need to take off my sweater. But they still have those feelings and emotions. And the brain doesn't lose its ability until very, very late in dementia. The brain is always going to want to try to problem solve. So, okay, I'm hot. I'm going to try to problem solve by taking off my shirt. And so when we don't always go with the initial or most obvious reason, and we kind of be that dementia detective to look at what's happening before and after this behavior, and figure out the root cause, then we can find a solution that works for everybody.
I love that. And I love that you gave that example. And what I am going to do, I'm going to post something that recently happened for me. And I would love for both of you to share kind of some tips. And hopefully this resonates with our other caregivers because I'm sure we're all going through a lot of the similar type of behavior. So I've been an out of the home caregiver for the entire time that my loved one has had dementia. But recently, my husband and I moved in to see if it needs to be a permanent living arrangement to really be able to assess what's going on. So while out of the home, there were times when my dad would call and say, he put my mom on the phone and she's like, "Come and get me. I'm not home. I need to get out." And I would talk with her and I would divert it and say, "Okay, well tomorrow I'll pick you up." And that would work. It would calm her down. What I didn't realize until moving in is that for her, as you were mentioning, as both of you were saying, it's very real for her. So the first time it happened when I moved in, I was like so shocked because I thought when I hung up the phone with her, it was going away. I didn't realize that it's not going away. Like it is still there. And so she was so upset and she's like pacing and she's going to the door and she's going to the window. And I'm like, you are home. I'm repeating it and she's crying. And then she's getting mad at me. And I was like, I don't know what to do at this point because now I didn't have the barrier of being like, okay, you're good. I'll talk to you later. So what would you all suggest for a situation? Because honestly, it kind of just eventually just fizzled out. I kind of just left the room, honestly. But I still wonder, like, what is the best way to handle situations like that where they're charged up, and even though you logically know that this is the disease, but what do you do?
Absolutely. I'll just start, Jessica.
Yeah.
So that is a very real thing that happens, and redirection is real.
Okay.
And you never know at the time. Well, not all the time. Sometimes the family has already been there, so they're like, okay, when this happens, we're gonna do this. But a lot of times you don't, especially as a caregiver. It's like you're new into the situation. You're like, oh, well, this is something I haven't dealt with before. I don't know what's going on, what's needs, and redirection can sometimes take some time, just finding out what they're thinking in their mind, or that they're not in their right space, or their usual habitat or whatever, or maybe they are and just don't realize it. But just having the, as Jessica was saying, the patience sometimes, because we can get frustrated with the situation. Like you were saying this over and over again, but it really wasn't taking with her. It's like, no, I'm in this wrong place, and it's really real to them. So
Yeah.
redirection, and we talk about this when we're doing our training, our yearly trainings with the hospital and things, is like, redirection, you want to try to bring them back to reality, but that doesn't always work. Like real time, let's talk about real life. This is
Yeah.
really happening. I need real time. That training is not what I seen yesterday in that room. Help me with that. And it's
Yeah.
just a matter of just being around, and that's another thing, consistency with, and that's what I try to voice to my clients. Consistency is real as well. If it's somebody that they don't know, that consistency of having that same person there telling them, you're okay, and they might not get it the first or second time, but by them continuously seeing his face and continuously hearing that, okay, well, I'm safe around, and them feeling that I'm safe around. Because again, like Jessica was saying, those bookshelves, things fall off, but that emotion is still there. So by them feeling that, okay, I've seen this face before, it's familiar to me, I feel calm around them, and just going through it, okay, we're going to go and try this, we're going to go and try that, because that's happened to me several times. Patients come in and they have the hospital dementia and so on and so forth, and we're trying to find out what's going on, why are they acting like this, and sometimes it's changing the caregiver. Their face was too familiar to someone that they really didn't like, and so changing the caregiver, and they're like, okay, I feel better, so I'm going to listen to them a little better.
Yeah.
And again, back to the initial question, it's just really trying to find out what's going on, and sometimes that's trial and error, especially in what I've found out a lot. And once you find it, it's like, okay, we got this, and we down pat, and
Yeah.
hopefully it can get better.
And I'll just add before Jessica, you
Yeah.
chime in. Part of the challenge is that my mom thinks I'm her sister. And
Oh,
so even during this period, and my aunt passed away. In fact, today actually marks the 3rd-year anniversary of her
wow.
death. And so what happens is she was like, I got to get home to the kids. And,
Mhm.
part of me, because, I've done the training. And so I think I knew not to challenge that, but in real time,
In real
I'm like,
time.
I'm the kid. And
Yeah.
she's like, why are you saying that? So Jessica, just I wanted to add that to get your feedback as well on that, on situations like that. What your thoughts are.
Absolutely. I think there's a few things happening there that make it challenging. The first is, in general, I think it always makes sense to, in terms of the confusion over who you are, um, roll with roll with it.
Yeah.
Roll with who she thinks you are, because what's most likely happening, in that moment, she thinks you're her sister because part of her brain remembers you as much younger.
Yeah.
But she does remember that you're someone whose family, you're someone she loves and can trust. So that's great. But just roll with it. If she thinks that you're her sister, you can roll with it um and just embrace what her thoughts are there.
Yeah.
With that issue of, her thinking that um your dad or anybody, in the house isn't supposed to be there, that can be a big challenge. Some things that you could try, um, and I think Renice did a great job answering this question as well. But some thoughts I would have is, see, could we avoid the problem in the first place? Maybe with, if she's still able to read, um, having some visual and written cues. So when she wakes up in the morning, or when she gets up from her chair, or whatever it is, whenever she's initially getting confused over, oh no, why is this person in my house? Maybe there's a place there where we can set up a reminder of, oh,
Mm.
this is, remember, there's someone in the house with you, he's safe. Or even,
Mhm.
there's someone in the house with you, that's your husband, whatever
Mhm.
it might be. If that doesn't work, the one thing, yeah, you definitely want to take it seriously. We often, when someone is agitated and scared, and we know that logically they're afraid of something that's not happening, our brain wants to, our natural instinct is to correct and say, no, you're fine, this is a safe place, you live here now, that's your husband, that's your caregiver, they're supposed to be there, whatever it might be.
Yeah.
But the person living with dementia, that that reality isn't there.
Yeah.
So instead, we've kind of created more tension again, because we're trying to be reassuring, but instead of connecting with them, they now don't feel like they can trust us to solve the problem. So what
Yeah.
we can do instead is say, okay, well, let me think. I do remember maybe somebody was coming over today to help you with something. Can I talk to them, or can you put the phone on speaker? Let me see if I can figure out why he's there and who he is.
Okay.
So then you're entering her reality. You're saying, yeah, you're right. That would be really scary. Let me figure out what's going on. Let me figure
Yeah.
out who this is. And it's kind of like playing pretend a little bit, but it's not, we're not creating some big elaborate lie to be disingenuous. We're trying to honor the emotion
Yeah.
that she's feeling, and tell her, wow, yeah, I hear you. That's scary. You know what? Maybe I think I remember somebody saying they were coming by today. Can I talk to him and see if that's who this is? Um, and then that might be a way to get around it so that they're not.
I like that. I like that. Thank you. I want to pause and see if anyone wants to ask questions, kind of maybe just run some behaviors that they're experiencing, and have our experts chime in. So I'll give it just a minute just to see if anyone wants to hop in.
I was
Yeah,
gonna add something too,
okay.
Lita. Just in reference to when they're moved into nursing homes, assisted livings, and things, and on memory care, because there's some really good memory care places out there. I've seen some magnificent ones where they actually have the men and women separate, and they have a whole system in place, and it's beautiful. But for those ones who are moved into, regular facilities or whatever, and they're out of their element, they're used to be in their homes for 50, 60 years, and now they're in this whole new room and place, and it's like, oh my God, what's going on? And we used to tell patients, family members all the time, bring in their favorite bookshelf, bring in their favorite stuffed animals or whatever they used to do. If they read the newspaper, bring in those newspapers and things like that. So it's a company, I believe Jennifer's company is Live Right Living. I can't remember the name of it, but anyway, she has a company, and I can always send that information to whoever needs it in Toledo as well, where they are a real estate company, but they
Yes.
help to bring everything, set up their whole room like a piece of their home. And I thought that was so amazing. I was like, oh my God, I never knew this existed.
Yeah.
And it's so beautiful. I tell everybody about her company all the time, because we used to tell people that, bring in something so they will be feel a little bit better about being out of their norm. And so when I found out about that, I was like, oh my God, I'm telling everybody about this, because that is wonderful. I love that.
Yeah.
Wish I would have
I
thought of it.
Yeah, I
Love
know, right?
that.
Yeah, no, you're right. And I will add that information. I always send this out to everyone who's attended, and who's on the email list. So I'll add that link as well, because you're right. That is definitely a good resource. So thank you for bringing
Yeah,
it up.
absolutely.
So as we talk again, going back to the difficult behaviors and compassion, what would you say now in some cases, these difficult behaviors, and I'm going by some of some of the comments and responses that are in our support group. Some of these things, my heart goes out, because I've seen comments where people are like, I am just done. They're experiencing anger, their loved one with dementia is really acting out, really, maybe becoming physical, putting them down, all of that. And while we know that on some level it's their reality, it's the disease, it doesn't take away how it impacts us, right? So, can you both talk, because that last piece is with compassion, right? So, what are some tips that we can do? Well, so this is a two-part question. One is, what are some tips that we can do to deal with that? The second part is, how do we decide sometimes when it is beyond what we can deal with, and not come to that decision with guilt? So whichever one of you wants to kind of start that conversation.
Yeah, I think that, or Ronice, do you wanna
No, go ahead,
start?
go ahead. You go first. Go
Okay,
ahead.
okay. I think that I think most people in my experience, could have made the move to either accept additional help in the home or to move into move their loved one into a community. Most people could have made the decision sooner. So I just say that to hopefully maybe alleviate some of the guilt, for what
Yeah.
it's worth, that if you're at that point where you're thinking about it, seriously, it's probably time. Um, and keep in mind too that if you are looking to move someone into a memory care or to accept, pay for some caregivers or nursing support in the home, um, they're going to do an assessment. They're going to tell you, yes, this meets our criteria, or no, it doesn't. And um, that, let the experts tell you, yeah, this is the time, or you know what, not quite yet, but now you're familiar, and when it is ready, you can come back. In general, there's always going to be some what we call transfer trauma. So when you do make a move, or when you do start having people come into the home, it's not going to go perfectly at first. So to prepare for that going in, so that you try not to immediately regret your decision and make make a rash decision to pull them out, but to recognize that there's going to be a transition, and really, I feel very strongly that caregivers, you need to take time for yourself. You need to prioritize your health and your rest. And your mental health is a part of that. Your stress is a part of that. There are real scary statistics about heart attacks. The caregivers have an increased risk of heart attack. So I don't say that to scare anybody, but just to hopefully, like, I think what I talk about with my caregivers and my support group is often like we add taking care of ourselves. That's the very last thing on our list. Self-compassion, right? We're talking about compassion for our loved one with dementia. We also need to have self-compassion. Make sure that we are giving ourselves time to rest, to take a breath, that we're not going to handle everything perfectly, but it's the best we do, the best we can do on a given day. It's not selfish to have self-compassion, and it's not selfish to take time for ourselves. It feels that way when you're in the middle of caregiving. You want to give everything to your loved one, but think about what if you do really give everything to your loved one and you're no longer here. If you notice that it's affecting your of course, caregiving is stressful. It's going to affect your sleep and stress levels a little bit. But if you're noticing that you're really having health challenges, you're having your own memory challenges, go to your doctor, see what your doctor thinks. But if you're having increased health challenges due to that elevated stress, then getting help and accepting help is really the best choice for you and your loved one long term. And really have that self-compassion.
I like that. Ronice?
Absolutely. So we all know caregiver stress is very real. My grandmother recently passed away, and she stayed with her well, it's the middle daughter, but she was the one that she stayed with all the time. And so they moved, back and forth a couple of times, and I was happy that she was here because, myself and my mom, which is her daughter, were able to help my aunts because, her children were younger, so they helped when they could, but it's a different story when you're that in the home with them all the time, and you can see it on someone's face, and that they need some help, and whether they ask for it or not, you try to interject where you can, to not make them feel as if they're insufficient. And I had discussions with my aunt. I was like, I'm not trying to say that you're insufficient in any kind of way. I want to help. My mom wants to help and just take the stress off of you because it's a lot, day in and day out, going to the doctor appointments and, making sure she was fed and make sure she was eating and make sure she was taking her medications. It's a lot. So the guilt and the shame sometimes I think sets in with the caregivers of saying, oh, well, someone's not thinking I'm not doing something right or something. And that's totally not the case. You have some family that really just want to step up. But for those ones that don't have that family to reach out to, I'm so happy for communities like Leaders and My Natural Me and Stronger Memory, because you have those memory cafes, you have those senior centers, online tools and communities that they can just ask the resources are out there. So by us having these type of discussions and putting all this stuff out there, I think is great because it just gives them another way to be able to deal with everything, because it's a never ending thing that's going to happen to the end of time. Someone's always going to be taking care of someone. That my healthcare field is going to be here forever. But the way that we navigate it is definitely a team effort. And so with us coming and doing things like that, I just want family members to understand that it's okay to seek help. It's okay to take mom to that senior center for an hour or two. And a lot of the places have respite care. I don't know I don't deal with insurance thing. I just like take care of my patients. That's what I tell my patients all the time. I like to take care of you. Insurance thing is not my, forte, but there's so many different ways out there that we can, give our caregivers resources so that they don't have, the stress of day to day feeling alone and that there's no one out there for them. Because one way or another, we can find something for you to get an hour to go to the movies or to go to the grocery store or anything like that. It's out there. We just got to come together like we are today and just communicate that. So,
Yeah.
yeah.
And I'll add a couple of things that I have found as well. Utilize your doctor. So in many practices, they now have some type of mental health therapy or conversations that you can take advantage of. It might be 4 sessions, it might be two. They'll assess and see what you need. And I will share. I took advantage of that with this transition, and one of the things that was shared with me that was so powerful, and I hope this resonates with someone here, or whether you're watching it on the recorded version: shame and guilt. And what my therapist reminded me is that guilt is when you feel that you've done something bad. Shame is when you feel like you are bad. And when we think about the role of a caregiver, there are going to be times when you're going to feel guilty. Maybe you really did snap at your loved one. Maybe you were having a bad day and then they spilled the juice and they're, and you might just in that moment, maybe you say something that you think about and it's like, you know what? I shouldn't have said that. I know they can't help it, right? That's a normal, healthy feeling and reaction. Shame, though, is when you believe you're a bad person if you don't continue to just take it and just stay there and you allow yourself to feel like you're this bad person. So when you're making these decisions, what I've been encouraged and what I encourage other people is, what will this impact my ability to have a healthy sense of guilt? Or will this, by staying in this situation, will I now be operating from shame? Because often caregivers feel so bad, and I see it all the time in the group. I feel like I'm a terrible person. I'm putting my loved one in a home. And I said, well, the first thing is stop using the word put, because I'm big on words and the power of words. And it's like, when you put something somewhere, you put a pet down or something, like that in itself is going to make you probably feel kind of crummy. But if you say, I'm relocating my loved one to a place where they could get sufficient care, doesn't that change the feeling? It removes this guilt, it takes away shame. Who wouldn't consider themselves a good person to relocate someone to where they can get sufficient help? So that would be what I would add to what you ladies have said, is that, if you're out there and you're really feeling like these difficult behaviors are becoming a lot and your quality of life is going down, look into those options, talk to someone, wherever you live, assisted living. I posted in our group the area on aging, the whole one that has like the where you can put in your area. Now I will say, okay, we have a question in chat. I'm gonna come back to that. I will say that you do have to be careful because every state doesn't keep it up to date or keep it, accurate, but that's a good starting place. Find out what resources are available. And let me just see the chat.
It was to me, my whiteboard was showing to everybody. I was writing notes.
Oh, okay. No worries.
I hope it stopped. Did it stop now?
No, I still see it.
You still see it? Let me just erase.
Oh, perfect. Now I don't see it.
Sorry.
Okay. But yeah, that's what I would encourage. When you're just trying to make those decisions, and maybe you are someone, I know I battle with this where I feel like no one can do it like I can do it. So even with my sister, I tend to take on everything. And if you're that person, you typically have people in your family who are quite fine with you doing that, right? So that's why I encourage maybe do a little work on yourself to learn your own reasons for doing things and being able to delegate. And last I'll add before I turn it back over to the experts is I've also learned and encouraged people to be very specific. You know, people will say, oh my gosh, I know what you're going through. What can I do to help? And you know, you might say, oh yeah, this is tough. You know, anything you can do to help would be great. Most people aren't going to operate from that. So what I tell people, be very specific. Hey, can you pick up these items from the grocery store because I can't leave the house because I'm with my loved one? Or can you come over here for an hour, 90 minutes? I just need a break, or I need to go take care of XYZ. Be very specific. I have found in the people that I've worked with and given this advice, it makes a difference. It makes a difference because it's not so overwhelming for the person. Sometimes they're afraid, like, what are they going to ask me to do? Because I don't know the first thing about helping someone with dementia, right? So if you're like, all I need you to do is push this button on the TV that will play the rainforest sound and calm their nerves while I go do whatever. I have a work call or whatever the case, right? So that would be another thing I would say, how we can deal with some of these difficult behaviors with compassion. I do want to, looking at the time, I want to give enough time for Jessica, you to talk about. So you talked about stronger memory. You have the picture there, but I do want you to talk about this amazing, I say discovery, because I know I'm working with
Yeah.
medical practices that are still not even in tune with this amazing research that you all have on brain care. And as you describe it, if you could also talk about what stage things could be even more effective with what you're going to share. So I'll turn it over to you.
Sure, absolutely. So, Stronger Memory, and I'll put the link in the chat. Stronger Memory is a easy, free brain health program, and it was actually created by Goodwin Living's CEO Rob Liebrick and his family. When he became CEO, they donated the curriculum to Goodwin Living because their goal with it really matched Goodwin Living's goal of just promoting positive brain health. So back in 2011, Rob's mom, Wendy, was experiencing cognitive challenges. She was getting lost in her really familiar neighborhood and really struggling uh, to remember things and remain independent. So at the time, Rob had been working in the field of senior living for about 9 years, but he looked around and still didn't see any solutions. So in 2012, he was at a national conference. Leading Age is the organization. They're a great national organization that supports resources and education for all of the nonprofits in the aging field. And he encountered some research there on really advanced dementia patients in Japan were doing simple reading, writing, and counting and numeracy. And they were seeing improvements on their cognitive test scores. So not just maintaining where they were at, but actually improving. So Rob asked his mom, hey, what do you think? Are you willing to give this type of work a try? He is married to a public health professional. So his first thought was, okay, how do we move this upstream and try to help people like my mom? So Wendy has been doing these exercises. She's been a Stronger Memory participant since 2012, really noticed kind of immediate benefit within a month. And then the question that Rob and Wendy and their family had was, okay, how do we share this with as many people as possible? So on Goodwin Living's website, strongermemory.org, you can download the free workbook, which tells you more details about what it is, and has a bunch of different math worksheets and writing prompts, because what our research shows, and we researched our specific program now with George Mason University and seen the same thing, that we're seeing improvement in cognitive scores from before people start doing these exercises, and 12 weeks after they've started, reading aloud, writing by hand, and doing simple math exercises for about 10 minutes each a day. 23 minutes total is what the data shows. That at least 4 days a week can really have a huge brain health benefit. This is a great program for anyone to do. We do it across many different levels of care. What the research shows is that people who already score in that what's called MCI, or mild cognitive impairment, often a precursor to dementia, our research showed that those participants seemed to have an even greater increase in their scores. So certainly something to use with early stages, and just to help that initial recall. But we've also been rolling out Stronger Memory through Virginia through a grant with CMS in skilled nursing homes, where we're doing this with people who have more moderate to advanced dementia, and they are still able to participate. And a lot of them have expressed, and their caregivers have expressed, like, reduced behaviors and reduced agitation, because they're cognitively improving a little bit, but they're also able to have a really positive social interaction. It provides great self-esteem to realize, oh, I didn't think I could write by hand anymore, and now I'm able to tell my story. So that's been really beautiful. And I just got a note from a caregiver recently. She said that she and her husband took the writing prompts with them on a little picnic, and they started talking about the different writing prompts, and reading aloud together and doing the writing and sharing what they've written has really brought, she said, it brought an intimacy back to their relationship that had kind of faded. So
I love it.
yeah, thanks for letting me share about that. And certainly
Absolutely.
reach out if you have any questions. You can download that workbook for free. But if you have any questions about how to use it, or any trouble getting the download, just let me know. And if you really want a printed copy, we do sell them just at the printing cost. But it's all for free to download and print yourself, or everybody's gone paperless nowadays. So however you want to use it is great.
I thank you so much for sharing. And I will say, even with my mom, doing activities, definitely every time we would go at the 6 month neurology,
Yeah.
it would be very little increase, very little. Now
Mhm.
she's at the point where we're seeing much more decline. But I will say, even though she's not quite able, she's a little past being able to do what's in that workbook.
Mhm.
Honestly, even just attempting to do it with her, because you mentioned that social aspect. So for
Yeah.
those of you who have loved ones who are very social, they like the companion side of things, even if you're not getting the answers right, I can tell you from my own experience that even just sitting doing it together, even if they're not getting the answers, even that can make a difference. And I will say, I recently took my mom for her regular, appointment with her regular doctor. And I was a little surprised. They do the clock, fill in the clock and the 3 words. For a long time, she has not remembered those 3 words. But this time she did. And I was like, oh, look at you, Fancy.
For her, good for her.
Wins, right? We take the
That
wins,
is
but
awesome.
yes. So I definitely just encourage, again, kind of going back to the theme of today's conversation, those difficult behaviors. We know that dementia and dementia related illnesses are what they are, right? We are going to see decline. Behavior is going to be impacted. But if we can prepare ourselves, if we can be equipped with some tools on how to deal with it, and then when the behavior becomes too much, if we can remove the shame and make decisions that are going to be good for them and for us. I think for me, that would kind of be my goal of today's conversation. So I'll turn it over again. Are there any questions, anything you want to ask our experts or share? I know sometimes these kind of conversations can be difficult to share because often you're with your person. But if you have anything, even if you can't do it today, feel free when you get the email back of the recap of this, certainly reach out with questions. Ladies, anything you want to add as we come to the end?
I did. I wanted to add also, is something that is not always spoken about, but our jobs, our employees have a service called EAP that you can get free therapy and things like that. So I would encourage anyone to look into their services because it's free through your employer, as well as throughout my journey of being in healthcare, sometimes people are used to just going. Like me, I'm always used to going. So, they fidget a lot. And it's just because they just need something to do. We had one young lady that was a wanderer, and but she was a house mother, a housewife. And so she was used to doing laundry and taking care of the kids. So we used to give her towels and washcloths. We used to let her do the little linen and things in the nursing home, and it just calmed her down. She would go do that, and she'll go sit and watch TV or eat a snack, and then she would start wandering again, and we'll just put the little pile there again and say, okay, come and do your laundry and thing, now it's here for you. And it was just the best thing for her. But they also have an occupational therapy, works a lot with cognitive issues. And recently I seen the hospital, I was so happy about this. They started giving aprons, and the aprons have pockets and buttons and different things to keep their hands going. So there are things online that you can find to help with someone that's more in an advanced stage that just needs something to do, like the stronger memory activity is perfect as well. But just in another tool is that you can find little things like that, or things just around the house, have them just doing what they normally do. They just want to feel a part of the routine. And it's a routine a lot of times that we found out too. They're just used to having a routine, and when that routine is thrown off, they're just like, oh my God, this is hectic. So putting them into a routine can be a big difference as well. So I just wanted to add that.
Thank you. I love that.
Absolutely.
And I see
Yeah.
the question in the chat. Jess, getting ready to call you Jess.
No, that's okay. You can call me Jess. My friends call me Jess.
Jess, do you want to tackle that one? I love that question. So I can't wait to
Sure.
hear your response. Yeah.
Yeah. Does it help to try to speak to the previous patient than the person that they are now? Believe that the sweet person is deep inside that patient. I think that and if I understand what this question means, you're trying to talk to the person that you knew and had a relationship with before the behavior is maybe manifesting most of the time. And I think that's a great what can be really beautiful and a great philosophy is to kind of um, merge those two personas in your head. That would be my challenge to you. And the short answer to that question is yes. The long answer to that question is you're absolutely right. That person who they are is still there. So they might not remember that's who they are. Um, there might be other things depending on the dementia affecting personality, but that's still who they are at their core. So talking to them as if they are still that person is really key. And one tool that you can use sometimes to get at that is music. Music is so powerful. It brings a whole connection. It's one of the last areas of the brain to be affected by any type of dementia. So using music can be a really beautiful way to bring back some of those memories of when we were younger. And then the last thing I'll just say is yes, they are the same person they've always been, but they might have to engage in new ways. So, for example, one time I was at a community where we had an engineer, a former engineer who made lots of things with his hands, tiny, fine motor skills. He couldn't build machines with his hands anymore, but he one day we were painting birdhouses, and we discovered he loved painting birdhouses. So don't be afraid to try something new. Ronice was talking about all the great kind of activity resources that are out there. Your loved one might decide, or your patient might decide, oh, I guess they've never painted before, but now it's something they enjoy. So don't be afraid to try something new. And yeah, short answer to that question, yes. Long answer, look at merge those two personas in your head. Yeah.
And I would add kind of like the advice that you all gave me earlier, right? Like also understanding that when that version of this person that we're not used to is surfacing, kind of going into it with the idea that they're trying to communicate something, right? So they are
Right.
still that person, but something, they're agitated, they're frustrated, they're,
Yes.
I think of it sometimes like if you've ever tried to remember like a song, and that's minor in comparison, but it can be frustrating, like, oh, I'm not gonna think of that song,
Yeah.
right? So
Absolutely.
right. So imagine if most things in life start to become that feeling where it's like that sense of frustration, and the brain can't tell itself that it's okay, you don't need to remember that, or it's so just it'll come to you, right? So I would just add that piece, like just recognizing that when you do that approach, you still may see some of that behavior because they're still frustrated with just where their brain is, right? So
Yeah.
I would just add that piece.
And our self-preservation instinct is really high. Our brain wants to, fix itself, correct itself, cover up for its mistakes and shortcomings. So unconsciously, things like paranoia and accusations, those can feel really hurtful and frustrating. They're coming from a place of the brain really not allowing that person to see that there's a gap in their memory, especially in those middle to later stages of the disease. The brain doesn't let them see it anymore.
I love it. Well, I am going to respect the time because I know our caregivers are sacrificing time in many cases. But I appreciate you being here. I hope that you're able to take away a nugget. You will get the email that will have a link to this, as well as the link to Jessica and Ronice if you want to reach out with some additional questions. And remember to take care of yourself. Don't forget, these are monthly. So we'll see you next month. They're always the second Wednesday. So you'll get that information. You should get updated because you're registered. And I think that's it. Thank you for joining tonight. And remember to show yourself. I love that. Show yourself compassion as well.
Thank you so much. Thank you, everyone. You all have a great night.
You too. Bye-bye.
Thanks,
Bye.
everyone.
Bye.